This morning, we are delighted to launch here in the United States a special series dedicated entirely to violence against women and girls in the Lancet. And most of you know the Lancet is the most prestigious public health and medical research journal in the world. In this series are 5 articles developed by experts in the field which show a global panorama of the problem. The Global Women's Institute has written one of these articles under the leadership of Director Mary Ellsberg, who is going to be one of our panelists today. And also it's a pleasure for us to have this morning authors of other articles in the series who will discuss their papers and the amazing work that they have been doing to advance in this field on violence against women. As part of this series, there is a call to action which will be presented by Dr. Lori Heiss. This call to action provides detailed recommendations of sustained strategies to accelerate the achievement of the elimination of this type of violence. We are also privileged to have other distinguished panelists with us today to discuss the evidence that we have, and all people who have been working in this field have developed to prevent and respond to violence against women and girls, and how this evidence can be used to create social change. We are very happy also to say that we are partnering for this event with the Milken Institute School of Public Health, with here in GW, with the World Health Organization, and with the London School of Hygiene and Tropical Medicine. As I mentioned, this afternoon there is this second event in the World Bank, where we organize jointly with the bank, the Global Women's Institute, and the Inter-American Development Bank, where we will launch a new resource guide for integrating prevention of and response to violence against women and girls across a range of development sectors. Now, it is my pleasure to introduce to you Dr. Lynn Goldman, who is the Dean of the Milken Institute School of Public Health, who will give opening remarks. Lynn Goldman is a pediatrician, and Dr. Goldman is a pediatrician and an epidemiologist, and she's also a member of the Institute of Medicine Council, vice chairman of the Institute of Medicine Roundtable on Environmental Health Sciences, a member of the NAS Board on Environmental Sciences and Toxicology, and a member of the NAS Report Review Committee. She serves as a member of the US FDA Science Board and the Advisory Council to the Director of CDC. She's a member of the Board of Trustees of the Environmental Defense Fund. Welcome, Lynn.
Good morning. I'm delighted to be here for the U.S. launch of this important series of the Lancet. And I'm proud that GW is at the forefront internationally of research on violence against women and girls. This is an issue that first came into my awareness when I was a medical student. And one day I heard loud screaming from the home next door to mine. So I went to the door to investigate, and what I found is that the young man who lived there with his mother was in the process of beating a woman with a cast iron skillet. And standing there next to her were her 2 young boys watching on. She had very serious injuries. She was devastated. She did not wish that I call the police. But I had connections she didn't have. I was able to get her into a battered woman's shelter where she could be protected from him and where a lawyer would get a temporary restraining order for her. But I never stopped wondering about the impacts, not only on her health, possibly the health of her children, that if she was pregnant, but also the young boys who were observing this as a model of male behavior. And how did they grow up? What happened to them? Were they traumatized by the experience? I have no way of knowing, but I am certain that on a personal level, that that episode that I witnessed was devastating to the health of all of the individuals involved, including the young man who was the violent perpetrator. Now think about this issue globally, and it is amazing to think that globally 1 in 3 women face either physical or sexual violence in their lifetime. It's an enormous impact. It's a pressing public health problem, and it's a problem that is contributing to and deepening the inequalities that are faced by women and girls around the world. It also is a problem that has intergenerational consequences. It is a problem that is passed on from one generation to the next in many different ways. So it's of vital importance that we are coming together as researchers and practitioners at events like this to discuss the evidence and how that evidence can inform responses from various sectors, particularly for women and girls. The health sector has a critically important role in the prevention and response to violence. The Milken Institute School of Public Health is extremely pleased to have as an ally the Global Women's Institute on the GW campus who convenes these conversations in hopes that we can affect positive change for women and girls, not only in terms of their health, but their well-being and their futures. Today, we'll dig deeper into the research on violence against women and girls as spelled out in the Lancet series. We'll talk about what the health system can do to effectively respond to violence. We know that the health system is often the first point of contact that detects violence and the impacts of violence. But we also will focus on an area that is too often ignored or under-researched, which is what works to prevent violence against women and girls. All well and good to respond once the violence is occurring and to try to protect the victims of violence. That has to happen. But I think it is so much more important for us to find ways to stop the violence before it starts. Because once this cycle of violence has begun, no matter what we do to intervene, there's a tremendous amount of damage that's already been done. This series goes beyond traditional research. In addition to providing new evidence on what works to prevent violence against women and girls, the articles in this series culminate in a call to action, which includes recommendations on how different sectors can work together to effectively prevent and respond to all forms of gender-based violence. I would like to thank the GWU staff, faculty, and students convened by the Global Women's Institute who have contributed to this special series of the Lancet, as well as thanking all of the faculty and staff who worked so hard to make this event a successful event today. So I'm very much looking forward to the conversations here today and hoping that they will continue to galvanize all of us in the critical effort to end violence against women and girls across the globe. Thank you so much.